Good afternoon, ladies and gentlemen. It is my great honor to welcome Professor Zurina Hassan from the Center of Drug Research, Universiti Sains, Malaysia, Penang. And let me say a few words of her scientific background and research interests. She graduated from the University of Manchester in Biomedical Sciences 1999 and completed her master from pharmacy in 2005 and PhD in physiology at the School of Pharmaceutical Sciences, Universiti Sains, Malaysia in 2012. Her expertise is in animal behavior and addiction and neurodegenerative disease and electrophysiology. She is a visiting scientist at the National Neuroscience Institute, Singapore, and visiting professor at Erlangen University, Nuremberg, Germany. The World Health Organization appointed her as an expert advisory panel on drug dependence in Geneva. She was awarded the Young Investigator Award by the Asian Pacific Society for Neurochemistry in 2016 and 2020. She is the guest editor from Brain Research Bulletin and a special issue entitled The Evolution of New Psychoactive Drugs and associate editor of Behavioral Brain Research and the Journal of Alzheimer's Disease. She also developed a new product for the treatment of mental health known as Natočeno 75TM and received an award at the 29th International Innovation and Technology Exhibition 2018. Recently, she won a gold medal in Inoxilla 2024 for the invention of Andronas. It is an intranasal nanoparticle system to improve cognition function. She has been appointed as a consultant by EU Sun International Singapore and as a specialist in traditional Chinese medicine for the establishment of a new formulation of medication for women's health. In 2021, she was awarded the George Foster Research Award by the Alexander von Humboldt Foundation, Germany, and the International Exchange Award by the Royal Society in 2024. So the lecture about Kratom will start it, and the floor is yours.
Thank you. Thank you, Associate Prof. Dr. Martin, for the very nice introduction about myself. Basically, I've been working in Kratom for more than 15 years, so you can know how old I am. I'm not like young as you see now. Basically, in Malaysia, people call me Dr. Kratom. In Malaysia, we call it Kratom as Kratom. So you can Google my name, and you can see that in Malaysia, they call me as a Dr. Kratom, since I've been working with Kratom for so long. So without further ado, I will start my presentation. I really love, because I've been working with Kratom for many years, and we have a lot of scientific evidence, and I've been published like more than 40 papers on Kratom alone. So before I start my presentation, I would like to share with you about the video on Kratom in Malaysia. Okay, I hope you enjoy the movie.
Mitragyna speciosa Koth is a tropical plant native to southern parts of peninsular Thailand and northern parts of the Malay Peninsula. Currently, it can be found throughout Southeast Asia. The plant is locally known as Kratom or biak in Malaysia and Kratom in Thailand. Kratom is a drought-sensitive plant. It is widely found in shaded lowland forests and freshwater swamps in the northern half of the Malay Peninsula, where soil humidity is high and exposure to sunlight being moderate. Kratom was officially identified and described by the Dutch colonial botanist Pieter Cottels in 1839. The plant was placed under the genus of Mitragyna of the Rubiaceae family by Cottles, because the stigma of kratom flower resembles the shape of a bishop's mitre. The color of the flower is yellow. It is a globular flowering head bearing up to 120 florets each that grows in clusters on stalks at the ends of the leaf axil. The kratom tree can reach a height of 50 to 60 feet and has a trunk of 2 to 3 feet in diameter. The trunk is usually in a vertical position and branches out. The branches of kratom tree are forked and the ovate leaves are tapered at their ends. The leaves grow opposite each other on the branch and are in average of 4 inches wide and 5 inches long. The leaves are dark glossy green in color and are constantly being shed and replaced, especially during dry season. There are at least 25 different alkaloids in kratom leaves. Its principal alkaloid, mitragynine, produces potent opiate-like effects. Mitragynine was found to be the most abundant alkaloid and is responsible for its opiate-like analgesic effect. There are 3 major varieties of kratom leaves, namely the green vein, the red vein, and the leaf with a pair of small teeth on both sides of the apex. The issue of which variety has better pharmacological effects need to be further investigated. Work is currently in progress at the Center for Drug Research, Universiti, Sains, Malaysia. Kratom using nom is considered as cultural bound, and it is traditionally used for its vast medicinal value, mainly in Southeast Asia. Unfortunately, due to its affordability and easy access, kratom is being misused by certain groups of people in the community. The leaves have been used commonly in treating mild medical disorders such as fever, diarrhea, hypertension, cough, pain, and to control opiate withdrawal.
Saya minum air ketum ni dah lebih kurang 17-18 tahun air ketum saya ambil. Tapi cukup bagus. Cukup baik untuk kesihatan. Memang baguslah. Siapa kata air ketum ni tak elok ke apa, saya marah jugalah. Sampai umur saya dah 71 tahun. Tak ada sakit apa, tak ada apa. Minum air ketum ni. Cukup bagus. Tapi minum dia nak ada peraturan lah sikit. Peraturan je kalau minum, segelas tu tahu suku je lah. Campur air panas. Minum satu hari minum dalam 2 gelas, 3 gelas cukup.
กระทมนี่มันใช้ได้การทุกสิ่งทุกชนิดยาไอคายเจ็บหัวแล้วเลือดสูงเยาว์วานมันใช้ได้ทุกชนิดบางซาเทคันเทอะไรมันได้ทั้งเป็นกระต้มนี่เทก็ว่าใจนู่นใจนี่มันไม่ได้มันต้องใจต้มแล้วเอาน้ำมันรดในตีนเทคันเทเขาเทอะไรนะมันต้องใจนี่สิ่งเดียวดอกเทก็ว่ายานู่นไม่ได้ยานี่ไม่ได้จะต้มน้ำกระต้มไปรดเทคันมันใจได้มันหายก็ว่ายาไม่ยารักษาอะไรมันเอาน้ำท่านนี่น้ำต้มดอกเทไปรดในตีนมันหายให้ขั้นให้ไรเทขั้นเทไรเทเป็นฮิตเป็นไรมันได้ต่างเป็น
Kelebihan air ketum ni memang bagus untuk kesihatan betul lah. Tentang kerja, dia tak rasa penat, tak ada apa. Rajin kerja. Macam saya dah tutup 70 ni, 71 kerja lagi.
กระต้มนี่ใช้ได้ติกาขั้นเอามาจะต้มน้ำเอามารดเอามาล้างแผลติขั้นนั้นแล้วก็เจ็บติกาเจ็บพุ่งขี้รูนั่นเอากินใบกินเขียวใบเลยกินน้ำ มันได้ทั้งเป็นแล้วต้มน้ำกินสำหรับโยเลือดสูงโยหวานเจ็บหัวแก้คายแก้อะไรก็ได้ทั้งเป็น
As for kratom consumption patterns, it is reported that kratom users often chew the fresh kratom leaf with betel nuts or by itself after removing the veins. Another common way to consume kratom is in the form of brewed kratom juice. Manual laborers commonly use kratom to increase work efficiency under the hot sun for prolonged durations. Kratom is also used to combat fatigue, suppress hunger, and reduce dependence on illicit opiates such as heroin. Despite it being banned in many countries and its reported negative perceptions, kratom is still widely used in communities for its unique therapeutic properties. And therefore, further research is urgently needed to provide more scientific basis to substantiate kratom's medicinal usefulness. Most importantly, the success of this research endeavor needs the support from global scientific community.
So you see in the video that I showed you just now is how people consume kratom in Malaysia. So basically, we drink a juice, so that the amount of the juice that you take is actually a very small amount. So that's the reason why it doesn't cause any physical dependence. So it's actually good for your health, and you can see from the local people who says that even they've been taking that for 71 years, and then they still have they can still work in the hot sun. You know, it's a very good for the health actually, if you are consuming at the correct dose. Okay, what I'm going to share with you today, I'm going to talk about the kratom, and also I would like to share with you what we have already done, the scientific evidence that we collected in the lab. So I will show you our scientific data that we already collect. Especially the first one, I will introduce to the kratom. If none of you know what is kratom, and then after that, we're going to go for the scientific evidence, especially to see whether kratom has the abuse potential or not. And then I will show you the data that we obtained, whereby kratom can be used as a replacement therapy for the opiate addicts. And the last one, I will conclude my studies to show the effects of kratom in cognitive function, so in the memory and learning. So basically, in my research, I'm working a lot on the mitragynine. So I'm not working, recently, we are focusing, because after we finish the studies on mitragynine, so now, currently, we are focusing on the kratom decoction. So we are developing a formulation, a new formulation, so that when people can consume, so it doesn't have a side effect for them. So now we are developing a new formulation for the kratom. So as you can see, the world, this is the world map by UNODC. You can see the drug problems in the world, basically is mostly on opiate. You can see the blue color. So you can see the blue color is actually the most prominent, problem is actually on the opiates. And then heroin is one of the largest problem abuse potential. And you can see mostly people are taking heroin. They are not only taking heroin, but they are taking other drugs. So it's like a poly drug. So most of them mostly using more than 3 other drugs together with the heroin. And heroin is a very high addictive, and at a high dose, it can be overdose and it can lead to the death. So it means that heroin doesn't have any ceiling effect, so it's a bit dangerous about that. And you can see people who are taking alcohol is 2 times more likely to be addicted to the heroin, and for the marijuana, 3 times to heroin. And you can see for those people who are taking opiate painkiller, like codeine, fentanyl, are 40 times more addicted to the heroin. And from here, the 296 million people are taking drugs in the world. So it's about like 1 in every 18 people who are taking drugs. So it's about 5.8 population of the world population are taking drugs. And you can see from here about 585 deaths caused by the drugs. And in Malaysia alone, our problem is actually on the opiate addicts. So our main problem is on opiates. About 180,000 are taking opiates. And how do we solve this, manage this problem is through detoxification and also the medical assisted treatment. So there are 2 types of medical assisted treatment, either using methadone or buprenorphine. But as you know that these 2, methadone and buprenorphine, has a limitation and also has a side effect. So that's the reason why we are looking for the new candidates to replace this, to solve this opiate addicts problem. So one of the candidates that we are looking at is actually the herbal plants that currently available, and it has been many years, I mean since 1935, has been recognized kratom in the world. So it's actually from the family of the Rubiaceae, and the genus is Mitragyna. But the one that I'm talking, I mean the video that I'm showing you just now is actually from the species Spiosa. So it's a Mitragyna spiosa. And this tree is only found in Indonesia, Thailand, and Malaysia, the species. So in Thailand, they call it as kratom or biak-biak. But for Malaysia, we call it as kratom, okay? And you can see here, from here, it has a lot of medicinal purposes. So it can be used for the treatment of pain, depression, anxiety, fatigue, okay, as well as for the drug addiction. But one of the main cause, one of the reasons people have been using this is actually it can be used also for the treatment of diabetic and hypertension. Okay, it can be used as like a coffee. Normally, you can just get a leaf, like a one or two leaves, and then just put on the cup, and then add on hot water and drink straight away. So it's good for your, it's good for your health. This is the genus of Mitragyna. You can see there's a lot. I mean, like in the plant list has included that about 17 scientific plant name under the genus of Mitragyna, 17, okay? So in the West country, this Mitragyna is the one that available in West Africa. In East Africa, they have this Mitragyna rubrostipulate. And in India, we have like about 6 Mitragyna genus with different species. But only Mitragyna spiosa is the only one has mitragynine. But the rest of the Mitragyna doesn't have mitragynine, only Mitragyna spiosa. So you can see this is the plant as I showed you in the movie just now. So this is actually from the leaf. There are 3 types of the leaf, either green or red, and also the stipulated leaf like this. Okay. So the effect of the leaf, they say that the most potent one is actually with the red leaf. So but actually this leaf within the one tree, you can find these 3 different types of the leaf from one tree. So it doesn't have to be a different trees. It's actually from one tree you can find these 3 types of the leaf. So they normally, this is the flower, and they normally grow in the swampy area. So in the swampy area, they grow very well, and they grow very good. In Malaysia, you see, Malaysia, we don't know whether this is actually a miracle or is actually a dangerous drug. But in Malaysia, kratom, not only kratom, it's actually the psychoactive of the kratom, mitragynine, has been placed under Poison Act 1952. And those people who are having this, like possess this, can be penalized with the 100,000 or jail 5 years, starting in 2022. Previously, before 2003, kratom can be used legally, so it doesn't have any problem. After 2003, it has been placed under the Poison Act 1952. So even in US also, they are still having a discussion whether they can be placed under the FDA or not. So it's normally some part of the US country is legal and some part is illegal. And they're being used as a dietary supplement and food additive. However, in Malaysia and Indonesia, it has been banned. But Indonesia still what they call it, exporting their product, the powdered form to other countries because it's cashing a lot of money to them. But within their own countries, they cannot use. It's been banned only for the exported, okay? But in Thailand, it's legal, so it can be used in Thailand. So you can see here, there's a lot of papers, newspapers in Malaysia talking about kratom because mostly the news is in Bahasa Melayu. The news is basically all bad things about kratom. So they are saying that now school kids also taking kratom, and then this kratom can cause physical dependence, a lot of bad things, negative things about kratom. But in our Center for Drug Research, we try to prove that this kratom is actually good for pain. So you see, kratom tahan sakit. Tahan sakit is actually for the pain management. So it's good for the pain management. So in Center for Drug Research, we're doing this study to show that that kratom can be used for the pain relief. So you can see here, there's on the right side and also the left side. The right side, on this side, is actually to show the good things about kratom. Kratom can be used as a pain relief. It reduces fatigue. It can also boost your energy, and it's also reduce the depression and anxiety, and it's also less addictive compared to the opiate. And it can be used for the alcohol, opiates, and other drugs. Now, we are focusing on methamphetamine. And then, however, on the other side, it's actually it's about this kratom. Kratom can also cause addiction for those people who are taking it more than the required amount. Okay, and some people, when they are taking, they have become physical dependent. So they have become tolerant, so they are taking more. However, it doesn't go up to the ceiling effect, means that even though you are taking a lot, it doesn't cause any death. And there's also issue regarding the tolerance and also the cross-tolerance, because most people are taking kratom, they are polydrug. So sometimes they are taking morphine and kratom, or they are taking methamphetamine and kratom. So there might be some interaction between the two drugs, okay? And it also can cause a memory impairment if you are taking a very high dose. So it can lose your memory. So it's not good, actually. Okay, so what is the benefit of kratom? Okay, kratom is actually has been used as an opiate-like effect and also cocaine stimulant effect. Because when you are taking kratom at the low dose, it can give you stimulant effect, similar as a methamphetamine or cocaine-like effect. But if you are taking at a high dose, it can cause you sedation, like a morphine. Okay, so that's the reason why they use for the pain. Now you can see most people are with the methamphetamine. They are also taking kratom to reduce their withdrawal effect. So they replace kratom when they don't take methamphetamine anymore. They replace with the kratom. So as you can see, mitragynine is the major alkaloid. It's about 66% of the, from the leaf, mitragynine is the main alkaloid, and 7-hydroxy is the potent one. The major, it's also the major alkaloid, about 2%. It's the most potent compound in the leaf. So now, up to today, there are about 54 alkaloids that has been isolated from kratom. And you can see just now in the video, they just mentioned about like 20, because that video is very long. I mean, like, I think 2017, something like that. So now, up to now, it's already like 54 alkaloid has been isolated from kratom. So I just want to highlight to you the most prominent alkaloids that has been isolated from kratom. I think in here also in UCT, Dr. Martin also have been isolated all these compounds. So the most prominent one is the mitragynine, and then we have the second one is penantin, spiogynine, speciolitine, 7-hydroxy, corinanthidine, and also the most common one is actually the corinoxine. So these are the most major alkaloids that has been used and tested from the kratom. And these are the list of the effects of the alkaloids. You can see, like for example, mitragynine, which present about 66%, it can be used as the analgesic, antitussive, anti-diarrhea, adrenergic, anti-malaria. So there are many good effects from the mitragynine. And also you can see penantin is used for the relaxing effects. And also spiogynine is also on the relaxing effects. And 7-hydroxy and mitragynine both are actually having the same, almost the same effect as the analgesic, as a painkiller. And corinanthidine is one of the opiate agonists. So you see here, as I mentioned to you, kratom can be used for the replacement therapy of morphine, because morphine is binding to the opiate receptor. So there are 3 types of opiate receptor, mu, kappa, and delta. And you can see here, mitragynine only at the mu receptor partially. It's not like fully agonist. It's a partially agonist. But it can also act on the alpha adrenergic. So alpha adrenergic 1 is also act as a partially agonist, and also alpha 1D is also partially agonist. You see, mitragynine is not pure, what they call it as a pure opiate agonist, because it binds to many receptors. Normally people say that this mitragynine or kratom is actually very dirty, because they bind to many receptors. So that's the reason why the effect is a bit low. It's not as prominent as morphine. When you are taking morphine, it can cause a ceiling effect. But for this kratom, because it binds to many receptors, so the effect is actually a bit low. Okay? So you can see here, 7-hydroxy is the most potent, is 5 times greater affinity towards the mu opiate receptor, the 7-hydroxy mitragynine. And this is the studies done by Boyer in 2008. It shows that how the mitragynine can interact with any other receptors. Let's say, for example, you can see there are adenosine, which is adrenergic receptor, and then they also bind to the dopamine receptor. They also bind to the opiate mu, and also this is kappa, and or delta, and also the serotonin. This is the studies done by the Boyers using the receptor ligand binding affinity. All right. So what I'm going to continue now with the scientific evidence that we got the data from to show us that whether is there any abuse potential of mitragynine or not. So we use in our study, whole of our study, we use mitragynine for the whole studies. So the first study to prove that, I mean, this is a common methods that have been used in the lab to test any potential drug, whether there is an abuse potential or not. So we either use a condition-placed paliferin, CPP, drug discrimination, and also intravenous self-administration. So this, we conducted all this study in our lab. And the first one to show us that you can see most of the drug showing CPP, means that this drug has the abuse potential. Let's say, for example, opiate, methamphetamine, cocaine, ethanol, and nicotine. When you use this CPP, they produce the CPP effects on the machine. Okay, even kratom metabolite and also a derivative also produce some CPP, but it's totally depending on the dose. Okay, I will show you what is actually happening when you use this machine. Okay, this is actually the how CPP is working. So we have 3 chambers. Okay, the 2 chambers. You see the first one, the gray color, this one, the brown color. So we inject drug, and then we put them into the let's say vehicle chamber. Okay, so you inject vehicle, you put in one chamber, and then you inject drug, you put another chamber. And then vehicle, drug, So it means that the animal will receive either drug or vehicle every day. So let's say, for example, you give the vehicle on day 4, 6, 8, and 10, and then you give drug on day 3, 5, 7, and 9. So on the CPP test, on this test, you put the animal in the middle, because this chamber, you see this chamber, there are different types of surrounding. Either it's a stripe or either it's a gray color. So when the animals enter into the chamber, they will recognize. So it's like when you are going to one place to get the drug, like the pot area where you can get the drug. So this is where animal can recognize whether the environment is actually drug or environment is actually vehicle. So during this CPP test, you put the animal in the middle, and then you see which preference they prefer. So most animals who are addictive to the drug, so they are spending more time in the drug pack chamber. So they spend more, they will go straight to the drug chamber, and they live there for more than, like the whole time. So that's how we calculate the time spent in the chamber. And then we also tested, like, we don't give any drug for 7 days, and then after that we prime with in the drug. So it means that we prime, let's say, for example, we give mitragynine or we give morphine just to produce the relapse, to reinstate the animals. And then when you reinstate, and then you do the test and see whether the animal is relapse or not, develop relapse or not. So from the studies that we found, you can see here. So we use morphine and methamphetamine, because morphine and methamphetamine is a positive control, because I mentioned to you they have like at low dose they have a psychostimulant, at high dose is a sedation. So we use morphine and methamphetamine, and both morphine and methamphetamine develop CPP. And you can see only mitragynine 10 and 30 develop CPP. So it means that the dose 10 and the dose 30 is the very high dose that can cause them to abuse potential. But you can see when it comes to the hyperactivity, like whether the animal is a psychoactive, developed psychoactive or not, you can see here the highest one here is actually methamphetamine. So methamphetamine develop hyperlocomotion, so it means the animal become very active. Okay, so you can see from the top one. But when you see the below one, all this is actually on mitragynine. So it means that the mitragynine, it doesn't cause hyperactive. But for the morphine, yes, it's developed, increasing the hyperactivity after a second session, third session, and fourth session. So this is to show like a locomotor sensitization for the morphine. The dose for this morphine is about 5 milligrams per kg. But for the methamphetamine, it's 1 milligram per kg. And then when we increase the dose of mitragynine from 10, so we increase like 20, you can see mitragynine also develop locomotor sensitization, similar as morphine. So there are contribution of the dopamine in the brain. So it means that it causes, at high dose, it also activates the reward pathway. So it activates the abuse potential. And we also measure the level of the dopamine levels in the mesencephalon and also ventral striatum. And we also looking at the dopamine transporter and dopamine regulating dopamine factors in this area. So you can see there is no level of the dopamine increase. However, there is increasing in the dopamine transporter. So to prove this, this is the experiment whereby we want to see if the animal is actually additive to the morphine, and then when we reinstate with the mitragynine, whether it can develop CPP or not. Yes, it actually can. So it means that the first one, we develop the morphine condition place preference. So it means that we develop animal to become craving for the morphine. And then after that, we reinstate with the 3 different doses of mitragynine. And it shows that these animals develop relapse, even at the low dose mitragynine 3. And this one is actually cross reinstatement mitragynine, and then we replace with the morphine. So you can see mitragynine and morphine can cross reinstatement, means that they have a similar pharmacology. So they have similar pharmacology. That's the reason why they can cross reinstate. So they can be replaced after that. They can be substituted after that. And then we also further our study to measure what is actually happening inside the brain. So what we do is actually we implanted the cannula on the brain at the 3 different regions of the brain. This region is actually for the reward pathway. So from here, and then during the experiment, we collecting the brain dialysate. We collect the sample from the brain. So when the animal is freely moving, so first we collect the sample 20 minutes, and then we inject the drug. And then after that, we're collecting every 20 minutes to see what is actually happening inside the brain, so the brain dialysate. So what happened is actually, you can see here, in the region of prefrontal cortex, nucleus accumbens, and caudate putamen. So the level of dopamine not change. So means that mitragynine doesn't increase level of dopamine. You can see methamphetamine and morphine really increase the dopamine percentage. However, dopac and homovalenic acid, this dopac and homovalenic acid is actually the metabolites of the dopamine. You can see the dopamine metabolized to dopac and homovalenic acid, and the level of this dopac and homovalenic acid is actually increased in both in this region, caudate putamen, and also you can see homovalenic acid is also increased in the 3 different regions. So what we can conclude here is actually that's the reason why you can see mitragynine doesn't increase the dopamine level. So that's the reason why the abuse potential of mitragynine is very low. It's not the same as the methamphetamine and morphine, because methamphetamine and morphine, it causes dopamine increase and it causes abuse potential, but not for the mitragynine, because it has been metabolized to the dopac and homovalenic acid. So we also studies to use the drug discrimination study. This is actually to show the abuse potential, whereby you can see when the animals pressing the level, there are 2 active levels, 1 active, 1 non-active. The one with active, it can produce the food. So when they, like you give a reward. So when the animal press the level, you give reward, you give food to them. So they will, once they know that when they're pressing this level, they will get the food, so they become additive. I mean, like it's like a subjective. So we want to test whether the drugs that bind to the same receptor can use this method, okay? So what we found, you see, from this drug discrimination, to develop animals to become craving for that drugs, for the morphine and mitragynine, morphine, it takes a very short period of time. So within 40 training sessions, the animal is already craving for the morphine. However, you need about more than 90 training sessions. So it means that the abuse, I mean like the mitragynine has a very low subjective effect, low abuse potential, because it needs longer time to develop become craving for the drugs. So you need more than 90 training sessions. And then we also testing to see whether it can be cross reinstatement like just now. So what we do is actually we develop the morphine. We develop the morphine trained animal, and then we use a different concentration of mitragynine. And we can see here, mitragynine 15 can only fully substitute of the morphine. So you see when there is a more than 80 pressing level, so means that the animal is, can be substitute. So here, when you develop the morphine additive animal, and then the 15 is the dose that can fully substitute. And you can see here, this is when you develop mitragynine, and 5 milligram per kg of morphine can fully substitute of the mitragynine. And here, for the 7-hydroxymitragynine, when you develop morphine, and then after that you reinstate with the 7-hydroxy, you can see the dose of 7-hydroxy, you only need 3 milligram. So you can see the difference of the mitragynine and 7-hydroxy, which is like 5 times lesser than mitragynine. So that's, you can see mitragynine, you need mitragynine lower dose compared to the 7-hydroxy. That's the reason why I said 7-hydroxy is very potent. And then when we do this using the naloxone to see whether is there any contribution of the opiate system or not, so we treated with the naloxone. You can see here morphine is fully suppressed when you give naloxone. However, mitragynine is a partially agonist, you see? So it's actually in a partial, but 7-hydroxy is also fully suppressed. And this is to show the intravenous self-administration. When the animal pressing the level, so we develop a cannula into the vein. So when they press the level, and then the drug will go straight to the vein. So the more they're pressing the level, the more drugs are going to the brain, to their vein. So from here, you can see mitragynine low. You can see this is the results of the mitragynine. So you see, even you increasing the dose of mitragynine, there is no significant increase. So there is a little or no self-administration of the mitragynine. However, you can see morphine and also 7-hydroxy, they are developed increasing in the infusion. So more dose, you will increase more pressing the level. And how this mitragynine and 7-hydroxy act? So we conducted a blood-brain barrier studies. You can see here the black color to show the drugs is transported from the blood into the brain, for the black color. So the gray color is actually from the brain to the blood side. So you can see here mitragynine and 7-hydroxy. Mitragynine is actually transported from the blood to the brain. So there are actually carrier proteins that transported mitragynine into the brain. So the mitragynine doesn't present in the extracellular. So but the 7-hydroxy mitragynine, you can see is actually a free fraction. So they are more located in the extracellular. So that's the reason why it's become more what they call high potency, because it's in the extracellular, okay? So compared to the mitragynine. And this is a summary to show that there are many types of the receptor involved in the mitragynine for the reinforcing effects. So now I'm going to show you what is actually happening of the kratom during withdrawal. As you can see here, this is, at the low dose is actually the stimulant effect. So the stimulant effect is about 1 to 5 grams. And the high dose is actually about 5 to 15 grams of the raw leaf. So this is the dose that can cause the effects. When you are regularly taking kratom, so at one time you become tolerant, so you become physical dependence. So this is what happened when you become physical dependent. So you develop anorexia, depression, addiction, and physical dependence. And also you can also develop psychotic symptoms. So this is a very, very high dose, okay? So this is actually the common kratom dependent, whereby they have a difficulty sleeping, and muscle spasm, decreased appetite, fever, all this kind of thing. So this is when the person is actually develop a physical dependent. So in the lab also, there's a lot of studies to show a withdrawal effect. So they also showing that mitragynine can relieve the opiate withdrawal, also ethanol withdrawal, and also they can also induce the physical dependence if you are giving like many times, okay? You're giving many times. And also this can also be seen when you interfere with the naloxone, and the animals develop the withdrawal. So this is actually the check that we use to measure the withdrawal. And this is the ones that I want to share with you, the most important data that we found. Okay, the first one is actually the animals when we develop morphine. So when we stop animals from taking the morphine, and then we just measure what is actually the withdrawal effect. We measure the scoring of the withdrawal effect. So you see, for this part, when you stop taking, they develop a very high changes of the withdrawal, and then it can last up to 28 days. This is for the morphine. However, you see, when we develop mitragynine addictive animals, and then you only need 9 days for the animals to become normal, back to the like normal. So you see the abuse potential of mitragynine. It can be back to the normal within very short period of time, not like morphine. Morphine you need 30 days to back to the normal, but mitragynine you only need 9 days. It's a very short. And then we also look at the anti-nociceptive effects. So this is actually the analgesic effects. So from these analgesic effects, we published this data in 2023. You can see here, we tested that different doses of mitragynine, and you can see mitragynine 30 can fully inhibit pain. So it means that the animal doesn't feel pain at all at the dose of mitragynine 30. And then here we develop the effective dose. What is the effective dose? You can see here the effective dose of the effective dose 50 is about 3.62 milligram, and effective dose 95% is about 20.84 milligram per kg. So these are the doses that can produce the analgesic effects to the animals. And actually, to convert, if you want to convert this to the human, you just divide it by 6, okay? And now we look at the effects on the cognitive function. There are a lot of studies to show effects of the cognitive function, especially on the kratom alkaloid, okay? And then the most important thing is to show that at high dose of the mitragynine, it can also cause impact place learning. So it means that high dose, it can cause impact of the cognitive function. And also it can cause changes of the metabolite profile in the brain. And this is one of the example, the passive avoidance task that been used to show whether the animal can causing the impact of the memory or not. So, and then the next one is actually, remember in the video I show you, there's what they call the swimming pool, whereby we put the animals in the swimming pool, and then if the animal remember, they will go straight to the stage, to the platform to save themselves. So what we're doing is actually we train the animal in the swimming pool, and then we see every day they learn very fast to go to the platform. So when you release them from any parts, they know where is actually the location of the platform. So every day when you train them, they only take a very short period of time to arrive to the platform. So here you can see the mitragynine 5 and 10 and also morphine showing a high escape latency. What it means is that the animal cannot find the platform, so they cannot think properly. So when you put the animal at the high dose of this mitragynine and also morphine, you place them in the swimming pool, they just cannot find the platform. So they cannot remember where is actually the location of the platform. So this is actually to prove for the effects on the spatial memory. So whereby the location of that. So we can see that the high dose is actually causing the cognitive impairment. And in my lab, this is my expertise. What I'm doing is actually I'm recording the action potential in the brain. So what I'm doing is actually recording between the CA1 and the CA3 pyramidal neuron. This is to show the impact on the long-term memory. So if there is a defect on the neuron of the brain, so they will cause lost memory. So the animal cannot retain the memory. So this is how we measure. We measure the action potential, what is actually happening in the brain. So from here, you can see that at the high dose, it causes impact memory. You see the action potential is actually reduced. So it means that there is some neuronal death in the brain that causes them, there is no connection between the neuron. So that's causing them, they cannot retain the memory for long. So at a high dose. And also you can see here when you give the current at a different intensity current, so it cannot, you see this is normal. When there is high dose, they cause a very small action potential. And we tested that in the, using the calcium imaging to see what is actually happening. And it shows that mitragynine is actually inhibit calcium influx. So that is the mechanism happen for the loss of the memory because it inhibits the calcium. So we conducted the same study, but repeated for 14 days, and it shows that very high dose caused the loss of the memory. And this is the latest papers that I published in 2023 to show that when we tested for 28 days of this kratom, we used the kratom decoction to the animal. We cannot find any mortality, any changes of, it doesn't cause any toxic effects to the animals. So it shows that it's actually, even the histological, biochemical analysis, there is no effect, side effects of the kratom for the toxicity profile of the kratom decoction in animals. So to show that the kratom is actually safe. So what I'm going, this is actually the conclusion that I'm going to share with you, that the high dose can also cause the CPP. And if mitragynine is actually a very low subjective effect compared to the morphine, and it's actually mitragynine 1 found to be safe. But in the local community, people normally use 10 milligram dose for the human consumption in the human. So the effects, the reason why it becomes a physical dependence. But if you are using less than 10 milligram per kg, it can cause less side effects. So the take-home message of this today's lecture is actually kratom can actually be used as an opiate detoxification to replace methadone and buprenorphine. And there is no lack of opiate overdose because you see kratom binding to many receptors. So the abuse potential of kratom is very low. So it can also, it doesn't cause any overdose. And it can also be used as a medication-assisted therapy, like I mentioned for the buprenorphine and also methamphetamine. But the problem now is actually to produce a standardized product that, you know, like most of the products that are available in the market is become adulterated. So they add on many kind of things to the products. That's the reason why the kratom become toxic or become addictive to some people due to the no standardized product. So in Center for Drug Research, we are trying to develop a formulation whereby you can control the dose so that the people, when they're taking, is safe for their consumption. That's what we are doing at the Center for Drug Research. Thank you.
Thank you for an excellent presentation, and we have time for a couple of questions.
You showed the data about long-term potentiation
Yes,
effect
yes.
and this
Yes,
reduction. So
yes.
what is like the mechanism?
The-
Like presynaptic or postsynaptic or AMPA receptors, NMDA are also involved?
Yes, yes, we already have the data for that, but I don't show it here. Yeah, because it's too scientific to show, but it's actually reducing the NMDA receptors.
So
It has a
reducing NMDA receptors.
yeah, it's reducing
Like
the
memantine or some other drug?
something like that. So it's actually
Is that open
reduced.
channel block? Or?
Yes, it's actually it's increasing the glutamate level also.
Okay.
So it causes it's a glutaminergic, what do you call? It increases the level of glutamate, and when we measure the protein, you know, the protein at the postsynaptic protein, which is involved in the long-term potential, at the high dose, all become suppressed. Yeah, I'm planning to show to you tomorrow for the presentation. So we show all the protein level, what is actually happening inside the brain.
Thank you very much for some talk. I was wondering if you were talking about pure compounds, so nitrogen and then cylinders nitrogen as well. But, you mentioned that there are like dozens of these alkaloids there. So
54.
Did you in the lab were you looking also for some synergistic effects for these different alkaloids, or were you working just with pure compounds from the beginning?
At the moment, we are only working on mitragynine, but now we already isolated many of these, and we are isolated quite a number. So now we are testing the effect of the others also, like spironolactone, all these kind of things. So now we are starting doing that. But you see, when you do this isolation, you know, especially, you see mitragynine is very easy, it's 60%. But when you are talking about spironolactone, everything, it's just like 1%. So it's very difficult to work with animal, you know, because you need abundance of that.
Have you studied the long-term use for memory impairments and the long abuse or chronic use of?
Yes. Yes. We did, but this is in animal, okay, in preclinicals. But my colleague is also working on the in human studies. They're also looking. There is actually not very severe effects of the cognitive function in human. It's not very severe. There is some changes of the cognitive function at the different types of the memory for the humans. But for our study in preclinical, we conducted the studies using mitragynine for 14 days. Okay, 14 days is actually similar as the 1 year consumption by the human, 1 year, 14 days. Okay, so when we tested this, we shows that at the high dose, only at 10 milligram per kg, it caused cognitive impairment, but not at 1 and 5 milligram per kg. So only 10 milligram per kg, even though you give multiple times for 14 days. That's the only one cause cognitive impairment.
Have you looked at the bioavailability compared to mitragynine and other drugs?
You mean like the pharmacokinetics?
Yes.
Yeah, we did studies about the pharmacokinetics of the mitragynine. The thing is, mitragynine is actually base effect. What do you call it? It's a basic chemical, right? So it's when you consume in the body, it's actually it's not fully absorbed in the stomach because it's a base. It's a base. It's a base. So it doesn't. So the effect is actually a bit slow because of it's not a very good absorption in the body, and the half-life of the mitragynine in human is not mitragynine in kratom. A half-life of kratom in human is 24 hours. But for the animals, for the intravenous pharmacokinetics of animals, rat, for example, so the half-life is about 3 to 9 hours. That's a preclinical study. But human is about 24 hours.
So have you standardized the doses of morphine and mitragynine to compare them with the effects?
Yeah, that's a good question. That's a good question. Normally, Normally, what we normally do is actually we use, I have no idea because I haven't think about that. So this is a good question, I should think about that. Normally, from the beginning of the study, we use 5 milligram per kg of morphine. So, and then we are comparing different doses of mitragynine. And then, honestly speaking, this is based on my, experience working with morphine and mitragynine. Morphine and mitragynine produce different effects. I mean, the mechanism is different. So because we study, I will show tomorrow the results, the data. Even though, because one thing, they have a different chemical structure, morphine and mitragynine. And another thing is actually, when we are doing LTP, it shows that morphine is improving the memory. But when it comes to mitragynine, it's reducing the memory. So there's two different effects, even though, but we use only one dose of morphine, 5 milligram per kg.
You said that in long-term high doses there no mortality, but have you tried to find out the LD50 for mitragynine?
We haven't tested the LD50.
Okay.
Yeah, we haven't tested it. But just to answer the question of you, the toxicity studies that we conducted just now, actually, the highest dose that we use is actually 150 milligram of mitragynine. And the animal doesn't die. Orally, 150 milligram. And the other studies that I conducted, 1, 5, 10, is actually through IP, intraperitoneal. So for the toxicity study, we give oral, 28 days, 50 milligram, 10, 50, and 150 milligram. All doesn't show any side effect. There is no changes in the liver, kidney, nothing. There is no toxic. 150 milligram of mitragynine.
Okay, so if there is no any question, so thank you once again for the excellent presentation.
Thank you.
Amazing. A lot of things from this, from the